Let's start with why central venous pressure monitoring is important. First, is it determines changes in cardiac function and abnormalities. This means a CVP greater than 6 mmHg indicates an elevated right ventricular preload, while a CVP lesser than 2 mmHg indicates reduced right ventricular preload. Second is, it has a relationship with the venous return in the body. Since venous return is usually simplified as a continuous flow returning to the heart, the mean value of CVP throughout the entire respiratory cycle has to be used. Third, it affects tissue blood flow. A high CVP value could decrease the CVP gradient, which in return could also result in a reduced capillary and organ blood flow. Lastly, it establishes a limit for fluid administration. Because it provides information about changes in venous return and cardiac function, it will determine how much we should put in. Let's move on to indications. So first, it is indicated for patients that needs measurement of the right heart filling pressures. Next, if patient needs drug administration to the central circulation, and if a patient has poor peripheral access. Next is indicator injection for cardiac output determination and access for insertion of pulmonary artery catheter. We also have contraindications. It is contraindicated when we are evaluating preload, volemia, and when predicting fluid responsiveness. Next, why is bone marrow aspiration important? So first, it is to assess how a patient's blood cells are formed. It is very crucial when additional information is needed, especially for abnormalities. To assess quantity and quality of each type of cell produced within the marrow, it is used to document infection or tumor within the marrow, and lastly, tests for cytogenetic analysis or immunophenotyping. We have these indications for bone marrow aspiration. First is patients with lymphoproliferative disorders. It actually diagnoses and monitors for these kind of disorders. Example, chronic lymphocytic leukemia. It's indicated for patients with cytopenia, thrombocytosis, leukocytosis, and anemia, since bone marrow aspiration can evaluate the iron status. Bone marrow inspection is also done to rule out infiltrative infectious diseases such as fungal infections, tuberculosis, and other granulomatosis. It is also for diagnosing non-hematologic conditions and storage diseases, as well as revealing toxic effects of certain offending medications or substances, and for patients with idiopathic thrombocytopenic purpura. We also have its contraindications. So first, hemorrhagic disorders. We all know that bone marrow aspiration is a procedure that involves taking sample of liquid part into soft tissues inside the bones. So meaning there is puncture. And when there is puncture, it will create a wound, which would greatly affect those with hemorrhagic disorders because they take a lot of anticoagulants. So this is the same thing for skin infections or has recent radiation therapy, and for patients with bone disorders. It is also contraindicated for patients that has increased intracranial pressure and patients that underwent prior lumbar surgery and has space occupying lesion.